do. So in a year, when we look at the compute candidate chart, we need to see an even bigger life science. We want to beat engineering, okay? Take over that. So now's the panel portion of the talk, which is where we can get you engaged and wake up some of our panel members who've been sitting patiently. Are there any questions? Anyone have any comments? I have a list of about 50, so it's me or it's you. So I'll start. Yeah, Brad's got some, so okay. So I want to start by talking about data quality. So big data clearly is going to be important going forward, whether it's in POG or whole genome sequencing, or whether it's segmenting populations to understand phenotypes better. And I wonder if, definitely Howard, Suzanne, maybe Paul and others can comment on what is it going to take to get the patients recruited so that you have the power you need to move from your phenotype, an N equals 1, which is kind of what POG is doing, to get the data where you can move from we can make decisions that are, you have the data to support them. And how do you aggregate those patients, get the data validated, things like that? So.
No, that's an excellent question, and one we struggle with. A lot of it has to do with developing more collaboration. So, and then sharing the data so that the N of 1 isn't just becomes more powerful if you can feed it back into the database and then validate those biomarkers. So realistically, it's about recruitment, accrual to clinical trials such as and other genomics. If you look in the US, they have other, PNH in Toronto has there's a match trial down in the States where it's a multi-center, large trial supported by NCI. So a lot of places are trying to do this and now aggregating all these populations, so it's with collaboration.
Okay. Aggregation among centers doing similar things.
Yeah, I would echo that approach as well, and also say that I think we need to look at the other side of the coin. There's been a lot of talk about next generation sequencing. Well, what about next generation phenotyping? And I think we can use a lot of that to actually help better inform the genomic studies. Our approach being to look at clusters. We initially started looking at physical and morphometric features, physiologic measures that might be more indicative of the embryology of autism in this case, and the genetic and or environmental factors that contribute to it, and perhaps even point to pathways that coalesce together. We're better able to identify that when we know more about the whole person. It can help make sense of the genomic information and better rule out what might be incidental findings versus those that are truly actionable, and point to various components of the phenotype.
Okay, where should we start? Okay. There's three things you can do. The first one, of course, is consent management. If you build consent management into a system and you can get consent, life is good. This is what the English have done. It's possible to do, you just need to do it. The second point is that it's very possible to do what they call blindfold analytics, which is to analyze data without revealing identity. It's allowed for in the HIPAA Act. I'll give you an example. I was asked about 2 months ago to look for people in a social services database, and in a prisons database, and in a police database, and correlate them to find kids that were at risk, and then release the names of those kids in a de-identified form to a minister who can then press the metaphorical red button to release that data to social services because kids were dying. So these are sort of things that we can actually do because I can do it on a computer without releasing the information per se to individual users. That's happening quite a lot. Another example would be here in BC, we measure the blood that we collect from transfusions and the blood that we use in surgeries. Now that histogram of blood we collect and blood that we use tells us a lot about the type and age of blood that we would go to and collect. And at the moment, since we de-identify data, when we store it, we can't look at those histograms, so we cannot inform best practice. Now that's just nonsense. And so this is something that the Ministry of Health have got to get figured out. And if we de-identify genomic sequences, then my guess is, and I'm not an expert, this is of not much use. So we have to get past this privacy issue.
Any other members of the panel want to comment? Anyone else? Question? Sticking with big data? Wow.
Can I just ask, are we collecting the data? So Howard or Suzanne, we just direct it to you, for either in POG or within the autism study? Thank you. So are we collecting the necessary data at this point to, let's say in POG specifically, to move this from a program that's supported by philanthropic dollars to actually being paid for by the system? So what is it going to take to actually, I mean, I know we're comparing apples and oranges, but if we look south of the border now, some of the POG-type programs are being covered by insurance companies now, and they are being covered. And again, I support what you said about there being some questions about the validation of some of the things that people are using right now that have been approved, but yet they've done that. What's it going to take to do that here? And Suzanne, I'd ask the same question of you with many of the tools that you're developing. I mean, it's incredibly exciting, both these areas. But are we collecting the necessary data that's ultimately going to inform Ministry of Children's Services or the Ministry of Health to actually cover this?
It's an excellent question. And I mean, we do have a health services research team that tries to look at this. I mean, from a objective point of view, it's looking at decision-making models and how do we accurately obtain the data about what is informative, what is actionable, did this change patients' management, and ultimately survival and outcomes. From a political standpoint, I think it's also what is the ministry looking for, and that seems to always be a bit of a moving target, I think. So we can collect all the objective data that we can, but it's also trying to figure out the political data of what the ministry fund. So I think there's two sides to that question. It's the ministry partners trying to figure out.
I would further address that by saying that I think we can get around these problems. I mean, one thing is in Canada we have the benefit of the Canada Health Act and provincially funded healthcare systems that allow us to still do a fair bit of what can be discovery research as part of clinical service promotion, and that's particularly true in the autism field. It integrates the diagnostic piece, the yes or no autism piece that is an aspect of health. It can integrate the next steps that come after that, looking at the various, the treatment outcomes, the services that are accessed as part of MCFD. All of these things are government-funded services and pools of data that can mean so much more if we're able to link them together and to have them inform research while at the same time being essential to services that are being provided. I know when we try and recruit individuals to our research, it really isn't all that problematic once they hear what we're doing, and that our aim is to deliver something back to them that's meaningful. It's not going to sit in the freezer somewhere as a DNA sample or a microbiome sample. There's a true effort to try and integrate the meaning of this data back to the individual, which brings people coming to us saying, I want to be a part of this research, and I want to know now how all this information can inform best practices and outcomes for my child. And I think that part of it has to be streamlined. I mean, there's funding that's going for autism services that is as high as $22,000 a year for treatments up until age 6, and then $6,000 thereafter. That's going to various different government agencies to support these things. Well, what if and some of those services that are being provided are not necessarily grounded in a strong evidence base. I mean, at least the treatments, some of the treatment aspects of it. If we could help inform those services and say, here, this is what would be a useful tool, let's use part of that funding base to access genomic screening services, which are the most costly of all of them. The microbiome work, metabolome work, all of those things can be added on fairly affordably or through other clinical service streams. The stumbling block comes with the genomics piece.
Can I just follow that up? So if I could just follow, and I'll direct this to Paul and to Dugan. So I guess my question would be, why don't we take an example like autism, and why don't we show that we can go west to east and do data integration right across the country, and that we can actually share these data sets in a meaningful way, that we can get the statistical power that's going to be required for you to validate these things, you know, and have the hard data that we're all looking for. So why don't we select something? And I think autism is one that is, I mean, it's on everybody's books right across the country as something that's caught the attention of all the health ministries. So, and social service agencies also. And so why don't we pick something like this and just do it? So what would it take to do it? So Paul, Dugan, I mean, so if we actually have the tools to anonymize this data, to allow, I mean, what is a forbidden thing is sharing of medical data across provincial boundaries. We don't really have a single payer system in Canada. So why don't we just do this as an example and show it can be done? And be done with it.
Sure. Okay.
That was Victoria.
That's how big it is. No, I think it would be a great thing to do, and in fact, in QQ Canada, we're itching for such examples. Something that will exercise the system. So we have, we serve researchers in BC, we serve researchers in Atlantic Canada, and all over the place. Each of them has a different health authority who are applying whatever their provincial rules are, their interpretation of those rules, which often don't say that they can't cross provincial boundaries, but it's not written, but it's interpreted that way. And so what we need is a project where we can demonstrate it. And so we have taken on some pilot projects, but nothing, I would say, that has a real national scope like that. We're involved in things within provinces, but not things that cross them. If people have the will to help us fight each individual health authority in that chain, work with positively to sign the agreements that needed to be signed, then I think there's not, it's not a technical issue that stops us. Let's put it that way. It's a political will issue.
I mean, I think what's important is that everything we do, I mean, at Genome BC that we fund, ultimately we hit what we call the N factor, where there isn't enough patients in BC that have a particular phenotype, and cancer, it doesn't matter, autism, it doesn't matter what disease you pick. I mean, where you hit a wall where you just don't have enough data, and you need to start going outside. And some of the most successful programs we've had in cancer, for instance, I mean, they've been worldwide. I mean, or looking at adverse drug reactions or whatever. So I think this data integration, it's fundamental.
Yeah, traditionally the problem has been that if I have some data here and I have some data there, I've designed my data, it's taken me 2 or 3 years to design Nike storage. You designed your data, we don't have any agreements between us. The data's part of my bailiwick, it's yours, we're not going to share them. We're heading quite quickly now to automate data sharing agreements. And so we can agree in advance what the data sharing agreement is, how much data we share, the type of data we share, the form in which we share the data. And so we turn the problem from a 2-year design on 2 sides to an agreement in a room around a data sharing agreement. This is coming. I think it might come first in cardiology. I'm hoping it'll come in autism as we go forward, but it's definitely coming. I see Alberta wanting to do this, Manitoba's wanting to do it. Ontario has an RFP out for it right now. They want to know how I do it. You have to have the notion of a lot of metadata, the geolocality of the information, where is the information, who owns it, how is it owned, how is it to be shared. This is all metadata. Once we have that, then we're free to do it. It just takes people then to agree. And so then it just takes people to agree. The other thing I'd say is in America, they've changed the law. The law in America now says if I want to, I can own my own data. As soon as I own my own data, I can do whatever I want with it, outside of HIPAA or any health authority or the equivalent in the US, at which point I can give it to any research studio I want to anywhere in the US, and off I go. And I did this deliberately to break the logjam of information held in institutions in America. So now I can request the data, they must give me the data, they have 30 days to give it to me. If they don't give it to me, it's $1 million fine. I can then do whatever I want with it, including all telemetry data, all the data about people who service me, any nurses, any doctors, anything. So the America is going that way to make an app environment out of medical data in the US, and that'll happen in the next 3 years.
So I know we have a question way back, Robin.
I think this is was roughly directed to Suzanne. This comment has been made, like the Genome BC Spring before, that really it's the lack of computational biologists in large profusion rather than compute power that is particularly the problem. And you know, we've seen things like assembly, thanks to people like Inash, who's around here somewhere, have gotten much more computationally efficient in fairly short order. Have you thought about this problem of computational biologists versus computers? I mean, they're not, or they're sort of both problems potentially, or they could simultaneously be problems. But do you feel you have enough computational biology resources for the things that you're thinking about doing?
Well, I mean, I'm tempted to defer that to Paul, to answer Paul Pavlidis down there in the audience. You know, there's an important need to have the merging of data, to unlock it, to have it all available in one spot. I like the idea of it being owned by the individual rather than being owned by agencies, and having it readily available to do as much as possible. And the actual interrogative exploration, the mining of the results, I see that as a role for the computation biologists, the bioinformatics people, that always have an awareness of what all the meaning is of all the various different data sources that are contributing to it. So yes, there's, I think, a role for both at this point. That's the intention of the development of our ASD base, is that's really where the interrogative functions are going to lie. To help perhaps even reduce the power that is inherent in these studies through the cluster association studies that we're promoting. I think once we start layering all these different levels of data on top of the genome and seeing how they integrate and interrelate with one another, it will make it much more informative, a much more informative model for genomics research that will reduce, hopefully, the power. And we've had some preliminary studies to look at that. But we're not dealing with hundreds of thousands of individuals, but at least less than 10,000 to get a meaningful number. And I think that's doable, honestly, within British Columbia. There's 56,000 individuals in this province with autism, and the problem's not getting smaller. It's increasing every year. And you know, I think if we can have, you know, part of the approach of iTarget is to have it as a proof of concept model that can scale out to other centers as well. So if we're going to do it, I think we need to do it right, where we're here and we have access to these individuals, and also the opportunity to collaborate with other large autism research groups, not necessarily just in Canada, but internationally, and to validate some of these studies and to really build a global effort in autism.
Any other questions? Yes?
Okay, I actually just wanted to re-ask Robin's question, because I appreciate what your motivation is, Suzanne, but that's an absolutely key question, and so I'm just wondering what people think about that.
So maybe I can talk a little bit about it. So it's certainly, I mean, the question you're asking, it's not even just specific to computational biology. I mean, all these kind of big data science things, there are many fields that are jumping in and have a need, but they don't necessarily have all the tools that exist in the computer science department. And so when Paul is an adjunct professor in big data science at S&P, I mean, that's an indication that universities are catching on and trying to train more people in that kind of area. And I would say, Canada, we have these 200 experts. One of the reasons they exist from our point of view, not just to help people do research, but to help use the facilities in an efficient way. So if someone is writing code, and I would say that it has been our experience that there's so much growth happening in this area right now that whenever growth happens at that pace, code happens very, very quickly. Not everything is planned in a very careful way, and so it ends up being a bit messy and a bit inefficient. And we have a crew of people who look at it and go, oh, if I had time to sit down and help people structure this and work together on it, we could really do some great things. So I think that there absolutely has to be a bigger effort to train people in the right techniques to make this a streamlined process, to use the facilities that we build in the correct way. it's a university thing, a Dugan Canada thing, and maybe it's a Genome BC thing. I don't know.
The US have decided, they issued a paper about 2 years ago now, that big data is going to be the way all public sector moves. They did a survey last year suggesting that there's probably 200,000 to 300,000 shortage in people that can do the work. So there's a big lack of people, especially in the data science world in the US. In BC especially, we have 6 universities pumping out a lot of people. So this is actually a competitive advantage for us, oddly enough. We can step into that vacuum that is going to be there and make quite a difference. It's an information sport, right? So if the more people we can actually sort of direct that information sport, the better we're going to do. So this is, I was around when Silicon Valley was starting up with networking in the 70s and 80s, and DARPA and networking made Silicon Valley what it is. The data science could make BC another Silicon Valley. This is what I tell the government. So, and they're very receptive to that as an idea.
So I want to just change tack for a minute and bring us back to sort of where we started today in terms of some user-driven projects. So move away from some of the large-scale sort of emerging opportunities and maybe structural opportunities if we look at bioinformatics and computational biology. So I want to address this one to Lauchlan. And I really wonder if you can comment on what it takes to get that industry-academic partnership established. I think this is going to be very important going forward. It's certainly something that Genome BC and Genome Canada wants to foster, that industry-focused genomic applications. Can you speak to that?
Yeah. Well, and my relationship with Mount Poly Mine was established before the dam breach, and as perhaps not as nice as it sounds, we happen to be in the right place at the right time. And in fact, and my relationship started with Mount Poly through networking and through attending conferences that were hosted by industry, which is the Technical Committee for Reclamation and Research. It's a BC mining industry, and I made sure that I made that effort to get out and connect with an organization that is mostly of industry and government and consultants, and very few academics. There are very few academics within that group. But making those connections allowed me to start up a project within the Mount Poly site to look at passive remediation of treatment wetlands to handle that overcapacity dam that, ironically enough,
There's a ton of feedback.
I just keep whacking at it and stop. So yeah, and ironically enough, it was that the dam that breached, but it did put us in an interesting opportunity to work with the mine. We made good relationships with the mine. We already had a funded project through MyTax and NSERC, and bringing Genome BC on board was just a natural progression. And I have to hand it to Genome BC because there's been groups that have visited our university, small university in the interior, and really reached out and helped us come on board and be a part of this. And I didn't even realize there was an emerging opportunity fund. It's not advertised. And so when I talked to Gabe about this, we have this project, we have this opportunity. This dam breach is unprecedented in mining history in Canada. And it's something that we have to take ownership of and correct as best we can. And so Genome BC was very pivotal in moving forward and helping us make those connections and working with the mining companies. So and so far the relationship has been very positive.
Maybe just ask the same question in a slightly different way, Lauchlan. I mean, I guess what I'm wondering is, the data that you're uncovering related to the mine breach, to the dam breach, again, it's difficult to say how informative that data is going to be over the short term to Imperial Metals to help them. In the long term, I think we're all convinced that this is going to be extremely contributory to finding solutions. So how interested is Imperial Metals in actually engaging with you? How good is that engagement? I mean, do you have a good working relationship with them?
An excellent working relationship with the mine and also with Imperial Metals as well. And we continue to move forward on this. They have, our research is very focused. They have immediate concerns about containment. They don't want increased sedimentation or erosion, so they need to act on that immediately. And to that purpose, they have consulting companies, and they're working towards doing those immediate short-range goals. But on March 6th, I'm organizing a workshop up in Williams Lake that will include academics from the interior universities as well as UBC Vancouver and the consulting companies that are doing these projects, and they'll be sharing with us their plans. And this is all brokered through Mount Holly Mine and Imperial Metal with their full cooperation and their full sharing. They want the facts out, they want transparency, and they're very interested in the results that come forward from our project.
That's great. I was actually going to follow up with you because I think we heard earlier, certainly in the oil and gas industry, so I think we can generalize to the extractive resource industries. Genomics is a fairly new area for them, so it's great to see sort of interest in this. It's too bad it comes at a crisis point, but I think it sounds very positive for going forward, your relationship and their continued interest in the workshop you have on. Do we have any other questions? I don't have a clock up here, but I think we're probably... Oh, okay, so we're kind of right on schedule. But any other last questions from anyone in the panel here? Okay, well, I'll just ask you to help me thank the panel again.